This is CPR. And this is television CPR. They might look kind of similar, but your odds of survival are way better if you have a little Hollywood magic on your side. One study of popular medical dramas found a 65 to 75% success rate. The stats are less clear in movies, but a review of popular flicks suggests movie CPR is on par with TV CPR. In the real world, your odds of survival are much lower, only 11%, and that's if you're lucky enough to get CPR from a bystander. But a 2020 study found that most people think CPR is successful about 75% of the time. Only a tiny fraction estimated the success rate was less than 25%. And where did they get this idea? Television. This isn't to say that CPR isn't a critical intervention. It can and does save lives. And it's far better than our earlier resuscitation attempts. But it requires much more precision and skill than whatever all this is. Let's start with the basics. What's the point of CPR? We asked an expert to explain and another to demonstrate.
The heart is a pump. In cardiac arrest, which is when you would do CPR, the heart stops. Suddenly, no place of the body is getting any oxygen, and that's why this is so very dangerous.
Cardiac arrest can happen for a variety of reasons: electrocution, drowning, plain old heart attack, and more.
So you, the person performing CPR, have to be in place of the heart. You're trying to, through the chest, squeeze that balloon of the heart enough to squeeze blood out. But then second part of that is that you have to let there be 100% recoil of the chest. If you have a little balloon and you just squeeze it all the time but don't let it get refilled, it can't pump.
Even well-done CPR is inefficient. It only supplies 30 to 40% of normal blood flow to the brain. But that's enough to keep people alive until the professionals take over.
You do CPR, you can double or triple their chances of survival.
Contemporary CPR is only 60 years old. But humans have tried plenty of other creative ways to resuscitate each other. There was the heat method, or piling hot ashes on top of a dead body. The logic tracks. The body got cold, so apply heat. Later, we tried the flagellation method, or whipping the deceased. This logic is less clear. We got a little closer to physiologic sanity with the bellows method. Introduced in 1530, it used one of these to propel air into a person's lungs. But by 1711, we had backtracked with the fumigation method, or quite literally, blowing smoke up a person's. Finally, 3 experts at Johns Hopkins University established modern cardiopulmonary resuscitation in 1960. They even made an instructional film about it called The Pulse of Life, which was probably the first and last time a movie has accurately portrayed CPR. Just watch what happened when we asked a real-life emergency physician to watch clips of Hollywood CPR.
He's like pushing, like more like that's like Ouija board CPR maybe? There's so much frenzy. Don't do gerbil CPR. He is doing a really excellent compression of her small intestine. Did he listen to his pulse? I think he put his ear there. Was he feeling for a pulse? Can we rewind? He's like slapping the patient. Just please don't watch this for any guidance on how to care for a patient in any way whatsoever. Can we please talk about how you're actually supposed to do it?
Yes, please. Lead the way, Dr. Long.
You're supposed to be about mid-sternum, so right the center of your chest. She's somewhere around his left shoulder.
Also incorrect: collarbone compressions, pectoral compressions, and
stop compressing people's intestines. Secondly, she's not giving adequate compression. You have to push at least an adult chest. You compress at least 2 inches.
2 inches for pubescent teens and older, 1/3 of body depth for prepubescent kids and younger. And yes, that's deep. Sometimes bone-cracking deep.
Sometimes in the process, you can end up fracturing ribs. So it's not something that you're aiming to do, but if you do it, you have to still keep going. Okay, pause. Here she's doing a good job of finger lacing, which you want to do, so props for that. And she's counting, good. She's also doing the old-fashioned, CPR and then breathing, but maybe she's trained.
Good news if you're squeamish about the breath part of CPR. For over 10 years now, the American Heart Association has encouraged hands-only CPR, meaning just compressions, for untrained bystanders. So call 911 and get pumping.
Oh, okay, there. Now we see she's doing a precordial thump. Oh, there we go. That's a little bit of a blast from the past.
This precordial thump shows up a lot in TV and movies. Like, a lot. But unless you're a medical professional in a very specific situation, just don't do this. Regular compressions only, please.
Most times people don't gasp, sit up like we see in the movies, suddenly come to life. But that does not mean that CPR was not effective if it was able to bridge until 911 got there. We had talked about what to do. It's also important to note that the CPR with breathing is still recommended in kids. So in adults, they say do hands only, but in kids, they still do CPR with breathing, which is what he does here. His compressions are a little light, but again, for children, you're not going to do the full two inches that you would do for an adult. But otherwise, he does do effective CPR and breathing for a child. What she is doing here that's bad is she's doing CPR kind of sideways. I don't know what she's doing. Again, you want to be 90 degrees to the patient. Your arms are going down like this. And she's doing it on a really soft, squishy couch. If you have soft surface underneath you, you're compressing against nothing. You can't do that. You have to put the patient on a hard surface. So he's kind of compressing his left nipple and doing some pretty ineffective compressions there. So that guy's a spine surgeon, and he's way too slow, and he's way too many pauses. I'm not impressed yet. So again, remember, you have to push quickly enough. So that's a rate of about 100 to 120. The American Heart Association has said that the Bee Gees song, Staying Alive, is actually the right rhythm, and if you just kind of hum that in your head, you're going to be pumping quickly enough.
Plenty of popular songs fall in this range, none of which we can use for copyright reasons. So here's a copyright-free 110 beats per minute song. Let's see how our heroes have done.
He hasn't had a pulse in over 15 minutes. You can't bring someone back that's...
He's not someone, he's my son.
No pulse for over 15 minutes. I mean, that's most likely going to be pretty incompatible with survival. I think this is a good reminder that when in doubt, if you're not sure, go ahead and do CPR. Call 911 and keep doing CPR until they arrive. If somebody's in cardiac arrest, you're not going to hurt them more than by leaving them alone pulseless.
At this point, you may be thinking, why does this matter? It's fiction. They can take liberties. And sure, TV characters and movie heroes get away with a lot that would kill us mere mortals. But real-life cardiac arrest is incredibly deadly. In the US, it claims more lives annually than colorectal cancer, breast cancer, prostate cancer, influenza, pneumonia, auto accidents, HIV, firearms, and house fires combined. Bad CPR from someone who learned from TV or movies is probably, how did Dr. Long put it?
Pretty incompatible with survival.
Right, that. Good CPR from a trained bystander could be the difference between life and death, but few Americans have up-to-date training. So if you want to be more of a hero than James Bond himself, find a local CPR class, like the one taught by EMT Roy at Revive CPR in San Francisco. Thanks, Roy. Or at least take 1 single minute to watch this video on hands-only CPR from the American Heart Association. What are your thoughts about this? Did we miss your favorite terrible CPR scene? There are just so many to choose from. Pop yours in the comments below, and now we can all tell what's wrong with it. Remember to subscribe, and we'll see you next time.